Hi everyone, it's your girl Ruth. Yeah, today I want to finish on the eye, what I was saying about the eye, and I want to focus, on the iris. We're going to see about that. Okay, the iris of the eye. Okay, I'm going to let it sit on it for a while, talk about it for a minute. It's the pupil, okay, that's the pupil. The color part of the eye is a thin circular structure in the eye responsible for controlling the diameter and size of the pupil and thus the amount of light reaching the retina. Eye color is defined by that of the iris. Disease of the iris. Diseases. Iris is inflammation that affects the color ring around your eyes. Pupil. Iris. The iris is a part of the middle layer of the eye, urethra. So iris is a type of urethra, also known as an anterior urethra. Iriditis is the most common type of urethritis. Affects the front of your eye. So this is a disease called the urethra of the iris. Okay. Okay, I think I got enough pictures of that. Okay, now we're gonna close this up and we'll go to another part and we close this up. I didn't mean to close that all the way. Okay, so let's go here. Okay, let's go to an overview. Yeah, there we go. So these are how some of the symptoms of the eye look. See, we got one over there, so they're showing us that. Okay, and then we got this one here. Instant. Okay, so y'all seeing that, and then something a little normal. How it gets to be the iris. But what I found interesting about it is they don't really know the cause of this. I know when I grew up, they were saying about could come from fractures of the eye where you got hit, something like that. But let's go back to this. Okay, oh no, that's the treatment. Okay, we'll come back to that in a minute. Okay, so they're saying that iris can occur in one of both eyes. It usually develops suddenly and can last 6 to 8 weeks. This is mayoclinic.org website. And go close to it. See, okay. Signs and symptoms: redness, as we've seen, of the eyes, discomfort, achiness in affected eyes, sensitivity to light, photophobia, diseased vision, decreased vision. Sorry about that. Okay, let's see. Iris develops suddenly for over hours or days. It's known as acute iritis. Symptoms that develop gradually or last longer than 6 weeks indicate chronic iritis. When you see a doctor, you see that. But my thing is, let me see, causes of it. They say irritation of the eye, injury of the eye, infections, genetic predisposition, BEHCETS disease, juvenile or whatever it is, arthritis, rheumatoid arthritis, scoliosis, certain medications. Okay, so of course some of the words I cannot pronounce. Sorry, y'all. So, but my point, they say, okay, risk factors have a specific genetic alteration, people with specific change in gene that's essential for a healthy immune system function, develop sexually transmitted diseases, certain infections such as syphilis, HIV, AIDS are linked with significant risk of iris. Okay, so weakening immune system, autoimmune disorder. This includes conditions such as ankylosing spondylitis and relative arthritis. Smoking also. Okay. Complications, cardiac, cataracts and irregular pupil, glaucoma, calcium deposits on cornea, swelling within the retina. Okay, so we're gonna take glaucoma first and see, cause let me go back up to the front and show y'all they don't even know the reason for this. Okay, what it says. Cause of often, see that right there? Let's see, let me put this up. It says the cause is often unknown, so they don't even really know, okay, how this happens. Okay, so we're gonna go to one of their treatments, and that's marijuana. And this is what they say about using marijuana, cannabis, whatever y'all calling it, are not an adequate treatment for glaucoma or any eye condition. I'm not trying to stop nobody from making money, which I feel is good for y'all, but I'm just saying, you know, me myself, if I don't want to be taking anything and doing anything that's not really going to help me. The treatment glaucoma eye pressure must be maintained 24 hours. So the eye pressure on the eye, so maybe we need to relax, meditate, you know. Marijuana is not particular treatment for constant use, okay? So it's not good for glaucoma at all, okay? The American Academy of Ophthalmology does not recommend marijuana or other cannabis products for treatment of glaucoma. The American Glaucoma Society and Ophthalmological Society agree. So why are they advertising for that? Several current effective treatments for glaucoma are more reliable and safer than marijuana. If you have glaucoma, you should follow your eye doctor advice to get the treatment for that's right for you. But they don't even know what causes that. They're just assuming all of this stuff. I can see from an injury they could see it, you know, if you get beat up at that time, but what years of it, but they don't really know, you know. So I just thought this was interesting to me. I'm just going to go by each thing that I find on the eye and see what they say the causes of it, how to treat it, and they don't know the cause of this one. Okay, so I just thought that was interesting, y'all. Okay, I want to go back to the eye so I can end up having that as my last, you know, view for my, because my, where is it? I want this to be the view that y'all see when I close it up. Okay. Okay, and I hope it don't show the white screen. Oh man, it will go to that. But yeah, this is what I want them to show for my thumbnail. My thumbnail's not working, so I just want to make sure this get done. But thank y'all for listening. I got some more on it, so I'll be back. Okay, bye y'all. Thanks.